So let's talk about something that can be just incredibly painful and frustrating, the frozen shoulder. We're going to dig into what it is, why it happens, and most importantly, what you can actually do about it. Have you ever had a pain in your shoulder that's so bad it literally wakes you up in the middle of the night? You know, a pain that makes something as simple as reaching for a coffee mug feel like a monumental task? If that hits home, well, you might be dealing with a frozen shoulder. And just to get a sense of how severe this is, check out this quote from a clinician. When you have people, women, saying that this pain is worse than childbirth, wow, that really gives you a stark sense of how debilitating this can be. We are not talking about a minor ache or pain here. All right, so let's get into it. Section 1 is all about this debilitating and often mysterious pain. Who gets it and what does it feel like? So, who actually gets this? Well, it typically hits people between the ages of 40 and 70, and it's a bit more common in women. Overall, it affects about 2 to 5% of us. But here's the kicker. For people with diabetes, that number jumps to a staggering 20%. That is a huge risk factor. You know, one of the most frustrating things for people is that this pain often just appears. There's no big injury, no fall you can point to. It just starts, usually as this deep ache that gets worse and worse, especially at night. And forget about getting a good night's sleep. Okay, so that's what it feels like from the outside. But what's actually going on inside the joint to cause all this trouble? So, the fancy medical term is adhesive capsulitis, and the keywords there are adhesive, as in sticky, and capsule. What's happening is that the capsule, this soft tissue sac around your shoulder joint, gets inflamed and starts forming scar tissue. It literally gets sticky and stiff. And here's a really great way to think about it. Imagine the joint capsule is like a loose, flexible sock around the ball and socket of your shoulder. In a healthy shoulder, it lets everything move freely. But with frozen shoulder, that sock gets inflamed, it thickens up, and it shrinks, becoming incredibly tight and totally restricting your movement. You know, this thing isn't just one steady state of misery. It actually evolves. So let's look at the 4 distinct stages that map out the typical journey of a frozen shoulder. So take a look at this chart. It really breaks down the whole journey. You start out in these first 2 stages, the painful and freezing stages, where pain is absolutely the main event. But then it shifts. By the time you get to the frozen stage, the stiffness really takes over, even though the worst of the pain might start to ease up. And finally, you get to the thawing stage, where things gradually get better. But look at that timeline. This whole process can take up to 2 years. Okay, with a timeline that can stretch out that long, you can see why getting the right diagnosis and getting it early is so important. Let's talk about how this thing is actually identified. And here's something that might surprise you. You don't always need an expensive MRI or scan. An experienced clinician can usually diagnose a frozen shoulder just by listening to your story and doing a physical exam. It's what they call a pattern recognition diagnosis. So what are the telltale signs they're looking for? Well, first, the pain is the main thing that started it all. That night pain is relentless. And here is the absolute key. Your range of motion is limited both when you try to move your arm, that's active, and when the doctor tries to move it for you, that's passive. And specifically, that motion of turning your arm outward, external rotation, is almost always the most stuck. Okay, so you have the diagnosis. Now what? Let's move on to what the evidence actually says about the best ways to treat this. Broadly speaking, you've got 2 paths. The vast majority of people are going to start with and succeed with non-surgical options. The whole goal here is to break that vicious pain cycle and get your function back. Surgery, well, that's really a last resort for those really stubborn cases that just won't get better. To deal with that really bad pain in the early stages, an intra-articular steroid injection, which just means an injection directly into the joint, can be an absolute game changer. It gets a powerful anti-inflammatory right where it needs to go. But, and this is a huge but, accuracy matters a lot. Okay, get ready for this because this number is kind of shocking. Research has shown that up to 50% of shoulder injections done without any kind of guidance don't actually get into the joint. Half of them. The shoulder joint is a surprisingly deep and tiny target, which means you could go through the whole thing and get 0 benefit. But when the injection is guided, usually with an ultrasound, the evidence is really strong. We're talking significant short-term pain relief, which in turn improves your range of motion. It basically creates this window of opportunity where the shoulder is finally calm enough for physical therapy to actually work.
There's also another technique called hydrodilation, which is like a guided injection but with extra fluid to help stretch that tight capsule from the inside out.
So, what about those people who don't get relief from the conservative route? Well, surgery, specifically something called an arthroscopic release, where a surgeon goes in with a tiny camera and cuts the thickened capsule, can be really effective. But again, this is usually safe for cases that have already tried other treatments for at least a few months. All right, we've gone through a lot: the pain, what's happening inside, the treatments. Let's bring it all home and talk about your path to recovery and the big takeaways. After all this talk of pain, injections, and long timelines, I really want to leave you with this reassuring thought. Frozen shoulder does get better. It has a natural history. While the right treatments can make the journey a whole lot shorter and less painful, time itself is a huge, huge part of the healing process. So if you're going through this, your recovery plan really boils down to these 4 steps. 1. Get an accurate diagnosis from someone who really knows this condition. 2. Get that early severe pain under control. A guided injection is a fantastic tool for that. 3. Use that pain relief as your window to commit to physiotherapy. And 4. Be patient. Be patient with your body and with the process. And that's really the whole story. Knowledge is power, right? Now that you have a map of this condition and you know the evidence-based options, I'll leave you with this. What's the first question you're going to ask your healthcare provider to take control of your recovery? Thanks for tuning in.